Let's go ahead and learn everything we need to know about pancreas to do great in nursing school and Medsurg or adult health nursing course and to be ready for the NCLEX. Let's start with pathophysiology. Pancreatitis is very simply inflammation of the pancreas. Now, there's two types of pancreatitis. There's acute pancreatitis and chronic pancreatitis. Most of what we're going to talk about applies to acute pancreatitis, but this video will cover both. Now, the risk factors for developing pancreatitis, first and foremost, is going to be gallstones and alcohol use. In fact, the majority of all cases of pancreatitis are related to one of those two causes. There are additional causes once we've ruled out the first two. If it's one of the cases that's not alcohol use or gallstones, then we start to check for things like an infection, which it might be, which would need antibiotics. We might check about medications. Certain medications can cause pancreatitis. High triglycerides would be a really big one that we'd be checking for, especially if the triglycerides are over 1,000, then that can cause pancreatitis. And cancer, a tumor, would be another thing that can cause pancreatitis. What are the signs and symptoms? Epigastric pain is going to be your classic symptom of pancreatitis. The pain may radiate to the back as well with this, and the patients are almost always going to have nausea and vomiting. There are two things that are commonly tested on. There are signs of pancreatitis, and both of these are signs of bleeding with pancreatitis. One is going to be Cullen sign, and one is going to be Gray Turner sign. Cullen sign is ecchymosis around the umbilicus, and Gray Turner sign is ecchymosis on the sides or the flank of the patient. Next, we have for chronic disease, specifically for pancreatitis, one of the things you're going to assess for is steatorrhea. Steatorrhea is fatty stool. Sometimes it floats, sometimes described as gray, as clay colored, but fatty stool is going to be another thing that we're going to assess for in chronic pancreatitis, which shows that it's not being managed well. Now let's look at the diagnostics. The diagnostics that we use, first we have a lab that we use. It's amylase and lipase. These two labs are the core labs that we use to assess for pancreatitis. If these are normal, we can be relatively confident the patient does not have pancreatitis. Now, the technical answer for this, and you probably don't need to know this for just RN level, is that the amylase and the lipase, if they're 3 times higher than the normal upper limit, that is diagnostic for a patient having pancreatitis. Lipase is considered a little bit more reliable. Now, any patient who has pancreatitis, we're almost always going to go ahead and get a CT scan with contrast in order to confirm the diagnosis and also to rule out anything else going on that could be causing the epigastric or whatever symptomology they presented with. We're also very often going to get an ultrasound. This is going to be specifically to check for gallstones because, like we said, once a patient is diagnosed with pancreatitis, we must know what caused it, whether it's gallstones, whether it's alcohol, whether it's infection, because that changes our treatment, whether it's medication, because that would make us stop that medication. We have to know what's causing it. The nursing assessment that we're going to do, we're going to start with a history and we're going to check out the risk factors like we just mentioned to see if we can start to put some pieces together. We're going to assess for all the signs and symptoms that we just went over. We're going to assess for signs of infection because that would be one of the underlying causes. So if they have a high white cell count, if they have a fever, things like that, we want to know in case that points us towards infection so that we treat it with antibiotics. And we really want to assess for signs of shock because pancreatitis can go into the patient developing full-blown shock. Nursing priorities are going to be for monitor for those signs of shock, again, because that's our number one concern with these patients. For nursing priorities, we're really going to want this patient to be NPO until they start to recover. We may put in an NG tube to get whatever's in the stomach out. That can help the symptoms and the progression of pancreatitis. Once a patient does start to feel better, we probably will pretty quickly start them on food, but they're absolutely NPO until they start to improve. And the core treatment that we're going to get to in a second is going to be fluid and pain management. So we want to make sure that we're focused on those from the get-go so that the patient starts to feel better. For fluids, moving on to treatment for fluids, LR is going to be our preferred option. We definitely want to make sure we have pain management. Most of these cases, the patients are going to need opioids to handle it. We're going to want to give them antiemetics because almost always pancreatitis is going to have some level of nausea and vomiting with it. Because pancreatitis can interfere with the insulin production, the patient may have an elevated glucose. So if they need it, we do want to make sure and give them some insulin to manage their blood sugar until the pancreas gets past this inflammation and is fully functioning again. If the cause is gallstones, we may want to do an ERCP, which is the treatment for gallstones, to get rid of it so that, again, pancreatitis, we want to fix that underlying cause. And then for chronic pancreatitis, I have to put one thing in here. The management of chronic pancreatitis is that the patient must take pancreolipase. Pancreolipase is a pancreatic enzyme, and the patient must take it with every single time they sit down to eat. They take it with their food. This must be taken with every single meal, no exceptions. And also, and we're going to get to this right now, client education has to be that they avoid alcohol, period. They are done drinking. The patients who have pancreatitis, whether it's acute or chronic, can never have a drink again. Any alcohol they have is highly likely to trigger another episode of pancreatitis. Pancreatitis education for chronic patients and for those recovering from an acute episode is going to be to avoid high-fat foods. They want low-fat meals. They also want to have small meals. It's going to be highly beneficial to these patients. We need them to quit smoking because that's another trigger for episodes of pancreatitis. And we want to make sure that they have enough fluids because dehydration is another cause of pancreatitis. There are a number of complications that may develop that you need to look out for. The biggest one is going to be pancreatic necrosis, which is where the pancreas becomes necrotic, which can be cause very quickly sepsis, shock, and death. We also have a few other things that you should look out for. I don't know how testable these are. I haven't seen these on any test banks, but they're definitely in your book. And those would be a pseudocyst rupture would be a known complication. Hyperglycemia, we already mentioned that one. ARDS, which is adult respiratory distress syndrome or acute respiratory distress syndrome. That's a very bad respiratory diagnosis. It can be triggered by pancreatitis. And finally, DIC, or disseminated intravascular coagulopathy, where patients start to alternately bleed uncontrollably and clot uncontrollably. Very bad diagnosis to have, again, can be triggered by pancreatitis. Hopefully this covers everything you need to know for pancreatitis. If you have any questions, please reach out. Otherwise, do great in school, and I'll see you in the next video.